McCain, Palen, Obama, Joe Biden? Who are you going to vote for? Well, you hear a lot of issues: national security, health care, economy. Yeah, I don't like the fact that I have to pay so much to drive. As a matter of fact, I'm not driving as much. I don't like the fact that this war is going on. I understand why we did it. If you've forgotten, over 3,000 of our people were attacked and killed. I have a son that's in the Marines. He's been to Iraq and he's going back, and I'm very proud of him. I have another son that's doing well for himself. They know the importance of having to make money, defend our country, provide for themselves, because the economy is bad right now. But healthcare, let's get back to that. There's a lot that's talked about healthcare, but there's not a lot of answers. I have heard McCain say that he would give people $5,000 during the tax time to provide them enough money to pay for their insurance every year. That sounds like a very good plan to me. All of those people out there that would be forced to get health care, whether they wanted it or not with Obama's plan, I don't want to be forced to do anything. Now, we really have a problem with medication, though. That's an issue that's not being talked about. We have a lot of problem with health care, but medication is a big problem because you go to the doctor, you come from the doctor, you usually have prescriptions. You can't go pay for those prescriptions. For instance, if a doctor puts you on a bill of fare because you've got bipolar problems, a bill of fare is $400 a month for 1 month's supply. $400 a month. Now with our company, what we do is we work with the pharmaceutical companies themselves. They have patient assistance programs where they give the medication to patients that need help and cannot afford it. We could get a year's supply of Abilify for a patient for $100. Now, that seems too good to be true, but it's not. These pharmaceutical programs have been out there for over 20 years. I have been nursing for over 14 years. We used to do this in the doctor's offices. Why don't you hear about it more in the doctor's offices? Because the doctors don't want the nurses tied up doing the paperwork. They don't want us on the phone with the pharmaceutical companies to track down the medication to see when it's going to be in for the patients that are calling us on the phone. They don't want us tied up doing that when we could be doing something to help them, and especially because they don't get paid for it. Okay? So that's why businesses like us, we've been established since 1999, have been doing the paperwork for doctors' offices. You don't hear about us a lot because we don't advertise a lot. But we do this across the whole United States. Anyone can call us, and we can do the paperwork for you to get your medication. Doesn't matter how many medications that you have. All it matters is that whether or not you qualify. Now, how do you qualify? If you don't have insurance, you definitely are going to qualify. Okay? If in most cases, unless of course you're just rich out there, unless you're one of these people that has all kinds of stocks and CDs and bonds and they're sitting on it, and in that case, then you don't need our help. We're here to help the people that do need our help. If you've applied for Medicaid and you've been turned down for Medicaid, you're an automatic to be approved for this program. If you're on Medicare D and you've reached that donut or that gap and you can't afford to come out of your pocket $3,600 to pay before your Medicare will pick back up on your medications, you are eligible for the patient assistance programs. If you have no insurance at all, you're eligible, like I said before. But if you do have insurance and you've got a $15, $30, or even a higher copay, you are still eligible, because that money that you're paying as that copay could be a hardship on your family. Okay? So it's not just one particular group of person. It is not just one particular group of age. It's anybody between the time that a child's born. They may need something for asthma. They may need something for ADD. We are trying our best now to get into the school system so that our children do not go without that medication that they need. Adderall, whether it be something for ADD or ADHD. We want to be able to provide that. So we're talking with the school board system so that we can educate people on that. We do go around the United States and do educational seminars to let people like our Job Corps. Job Corps has a lot of students, and they buy their medication. The wellness centers buy their medications from the government pharmacies, and we can dramatically lower what they have to spend out of pocket so that they can take that money and they can put it into other areas that they were not able to afford to buy before. So there's a lot of different medications that are covered, a lot of different areas we can help with. I'll throw out some medications that you may know: glucophage, glucotrol, Prozac, insulins, cancer infusion medications. So many medications are covered. About 95% of the medications out there are covered under the patient assistance programs. Now, it's not that hard to apply. All it takes is one simple phone call. You can call us at 1-229-873-3221, or you can simply go to the website www.specialpatientsinneed.com, and it will tell you on our website all of our other numbers. There's also an 800 number that you can call. Why would you want to go to our website? We don't just offer help with medications. We are affiliated with so many different organizations and community ties that we can tell you in your area where you may get help, such as if you can't pay your utilities, if you need help buying food, you can go to certain food banks. There's a lot of organizations that can help in your communities. We also let you know how you may be able to get some of your medical bills written off. Do a lot of you people out there know that today that most of our hospitals have indigent patient assistance programs? What that means is they get government grant money to write off bills for patients that don't bring in that much income, or maybe possibly no income at all. But yet, if you don't ask about it or you don't know about it, then it's not going to be able to be written off. You have to know about these things. We have a lot of this information on our website. So, what we're trying to do is educate people out there. We need help from our leaders, though. We need help from the people that are higher up on the political agenda. We need help for them to get the word out to the people that these programs have been in existence for over 20 years. Why not have people like us all across the United States, and it to be nationally known, so that people are not going and walking in the drugstore and paying, like my mother has, $1,500 when she went into her donut hole in February of this year, 2008, and my dad paid $1,500 for 1 month's supply of medication. Now you may be wondering, well, why did he pay $1,500 if y'all can get that medication for her? Well, because it does take 4 to 6 weeks to get the first shipment of medication. So we do have to go ahead and get the paperwork done. We do charge a fee. We have to charge a fee just to stay open, to stay available, to help people. That is our mission, to help people out there that need our help, to help people be compliant in taking their medication. So we charge $100 for one medication, but you get a year's supply of that medication, no matter what it costs you at the drugstore. If that medication, like we have an infusion, a cancer infusion medication that costs $1,800 a month for this cancer patient to take, we can get them enrolled in the program, and it will cover the year's supply of those infusions for $100, just simply because we got them enrolled into the program. So what we're trying to do is help our people out there. We don't want people dying of a heart attack because they couldn't take their medication, because they couldn't afford to get but half of a month's supply of their medication because they had to go buy groceries, or because if they didn't pay the utility bill, their utilities would be cut off. All we're simply asking is to get the word out so that people know. Have us on Hannity and Combs. Have us on Bill O'Reilly. Put us on the national news so that we can let people know these programs exist. That's all we really want to do, is just help our fellow man.